All right, so today we're doing a crown preparation on tooth number 21. So I kind of want to go through our protocol, what we do here at Healthy Smiles Dental Care. The first thing we do, obviously, is we go through their health history. The patient had a knee replacement on her lower right, or the lower right knee here. And you've already taken your pre-medication, right? You took your 4 pills, amoxicillin, 500 milligrams, 1 hour before. So we go through the health history. I do the blood pressure, and the blood pressure is always written down. Miranda's my assistant today, so she wrote down the blood pressure. We want to make sure, this is 130/82. It's not too elevated, but if it is elevated, when you do your chart notes, you want to make sure that you tell the patient, hey, you have an elevated blood pressure. You might want to see your PCP to get that evaluated. In this situation, we don't. My assistant will always write on the actual tray paper the actual procedure that we're doing. So we have all that information. Also, the computer timed out, but we actually have the picture of the actual crown that we're doing on tooth number 21. Then we take an initial impression with the blue light, and that is, you want to make sure you check this. We're doing number 21, so it's this one right here. I want to make sure I have all the margins intact before I start. If not, I just want to do another quick impression. I can even add to this existing impression. So that looks good. Patient is pretty numb. We always have safety goggles on our patient. That's really important. Any procedure that you're doing, you don't want anything to fall in the patient's eyes. The assistant will do a pre-scan for you here. So I want to check the pre-scan before we start. So I take and I hit the, we're doing a lower prep, so I get rid of the upper model, and I look at the preparation that we're doing. So we're doing right here on this 21, and you can see the patient has a large restoration on the buccal, on the DOL, and there's a little crack line you can see right there on the meso. Now what's nice about this is actually a good photo for your insurance. You can actually show that crack line and just take and hit that picture right there, and it'll show you that you saved that for the insurance company like an IO photo. The other thing I like to do is I like to do a 4-quadrant impression or picture, and this is really nice because it's actually having a virtual study model of the patient's teeth before we start. So I save that, and so now you've automatically, you see it saves right here. Now you automatically have a detailed information of the patient's mouth before you prep anything. The last thing I do is I go through and I check their occlusion, so we know exactly what the occlusion looks like before we actually prep it. That way the patient won't come back to me and say, oh guys, ever since you prepped the tooth, my occlusion's off. This tells me exactly what the occlusion looks like on the tooth that we're prepping and on all the other teeth. So I go over to this camera on the upper right and I hit that, and it saves that for me as well.